An abscess is a tender mass, generally surrounded by a colored area, often pink or deep red. This discoloration is a sign of inflammation, indicating that your body is actively fighting an infection in that area. It is a collection of pus, a thick fluid containing white blood cells, dead tissue, and germs. Pus is essentially the battlefield where your immune system has fought off invading pathogens, and it accumulates as a result of this ongoing battle. Abscesses can form almost anywhere on your body, both on the skin surface and deep inside. Common areas include the armpits, areas around the anus and vagina, the base of the spine, around a tooth, and even within internal organs. They are the body's way of trying to heal from an infection. When your body detects harmful bacteria or fungi, it triggers an immune response to isolate and destroy the invaders. When bacteria or fungi invade, your immune system sends white blood cells to attack the germs. These white blood cells, also known as leukocytes, are the soldiers of your immune system, working tirelessly to protect you from infections. During this battle, some tissue may die, creating a mixture of dead cells, germs, and fluid, which forms pus. This process is a natural part of your body's defense mechanism, although it can be quite uncomfortable. This pus collects in a pocket, forming the abscess. The pocket is essentially a confined space where the body tries to contain the infection, preventing it from spreading to other areas. Think of an abscess like a small, inflamed sac filled with this unpleasant mixture. This sac can vary in size, from a small pimple-like bump to a large, painful swelling. It can be painful to touch, and the skin over it often feels warm. This warmth is due to increased blood flow to the area, as your body works to fight off the infection. Sometimes an abscess will come to a head, meaning you might see a point or tip from which pus might drain out on its own. This drainage can provide some relief, but it doesn't always mean the infection is completely gone. However, many abscesses need medical help to heal properly and safely. A healthcare professional may need to drain the abscess and prescribe antibiotics to ensure the infection is fully treated. Understanding abscesses is important for your health as they are quite common. They can affect anyone, regardless of age or health status, and knowing how to identify and treat them can prevent more serious complications. Knowing what they are helps you recognize them, leading to quicker treatment and preventing complications. Early intervention can reduce pain, prevent the spread of infection, and promote faster healing. This knowledge empowers you to take good care of yourself and know when to seek advice from a healthcare professional. By being informed, you can make better decisions about your health and ensure you receive the appropriate care when needed. The formation of an abscess is a fascinating yet complex defense mechanism of your body. It all begins when harmful germs, such as bacteria, find their way into your body through a cut, a hair follicle, or even an internal organ. These tiny invaders can cause significant trouble if not dealt with promptly. Your immune system, always on high alert, detects these unwelcome guests and immediately launches a counterattack. This is your body's way of protecting itself from potential harm. White blood cells, the soldiers of your immune system, rush to the site of infection to combat the harmful germs. This battle causes inflammation, a sign that your body is fighting back. As a result, the area around the abscess becomes red, swollen, and warm to the touch. These symptoms are your body's way of signaling that something is wrong and needs attention. During this intense battle, many white blood cells die along with the invading germs and some of the nearby tissue. This is a natural part of the immune response. The accumulation of these dead cells, germs, tissue, and fluid forms a thick yellowish substance known as pus. This collection of pus creates a pocket, which we recognize as an abscess. The body then walls off this infected area to prevent the infection from spreading. However, this containment can cause significant pain due to the pressure it exerts on the surrounding tissues. If left untreated, the abscess can continue to grow, increasing the risk of the infection spreading to other parts of the body. This is why timely medical intervention is crucial to prevent further complications and ensure proper healing. One of the most common causes of an abscess is a bacterial infection, often from Staphylococcus bacteria, entering through a break in the skin. Minor skin injuries, like a small cut from shaving or a puncture wound, can lead to abscesses. Blocked sweat or oil glands can also become infected, resulting in abscesses like boils or carbuncles. Hair follicles can get blocked and infected, developing into an abscess known as folliculitis or a boil. Good hygiene, such as washing hands and cleaning cuts, can help reduce the risk. However, even with good care, abscesses can still occur. especially in people with weakened immune systems. Beyond common skin bacteria, fungi and parasites can cause abscesses, though less commonly. Internal abscesses can form from infections in organs like the liver or lung, spreading through the bloodstream or from direct injury. Foreign objects embedded in tissue, like a splinter, can trigger abscess formation. Certain medical conditions, such as diabetes or a weakened immune system, increase the risk of abscesses. Dental abscesses can develop from tooth decay, and internal abscesses might arise as complications of other illnesses, like appendicitis. Recognizing an abscess early is crucial. You might first notice a small, red, swollen area on your skin that feels tender or sore and warm to the touch. These initial signs can be mistaken for a pimple or insect bite. As the abscess develops, pain might increase, and a more defined lump may form under the skin. Localized itchiness can also be an early sign. For internal abscesses, early symptoms can be vague, like feeling unwell or having a low-grade fever. Ignoring these early warnings can allow the infection to worsen, so paying attention to your body is key. If an abscess is not treated, symptoms can become severe. Pain intensifies, redness spreads, and swelling becomes more prominent. The skin over the abscess might look shiny and stretched, indicating significant pus collection. A key sign of a maturing abscess is the formation of a head, often yellowish or whitish. The abscess may feel soft and fluctuant, meaning you can feel the liquid pus moving inside. Systemic symptoms like fever, chills, and swollen lymph nodes may develop. Red streaks spreading from the abscess indicate a serious condition needing urgent treatment. Untreated abscesses can lead to complications like sepsis, which is life-threatening. When you visit a doctor with a suspected abscess, they will ask about your symptoms and medical history. The doctor will perform a physical examination, checking for redness, swelling, warmth, tenderness, and fluctuance. For deeper abscesses or unclear diagnoses, further tests like blood tests or imaging, ultrasound, kinetic scan, MRI, might be needed. Sometimes, a sample of pus is taken for lab tests to identify the specific germs causing the infection. Accurate diagnosis ensures you get the right care for your specific situation. The primary treatment for most abscesses is drainage, also called incision and drainage, I and D. The doctor makes a small cut to allow the pus to drain, providing immediate relief. For small skin abscesses, this can often be done in the doctor's office with local anesthesia. After drainage, the doctor may clean the abscess cavity and pack it with sterile gauze. Antibiotics are not always needed for simple skin abscesses, but might be prescribed if the abscess is large or the infection is spreading. For internal abscesses, treatment can be more complex, often requiring drainage guided by ultrasound or CT scan, and sometimes surgery. Antibiotics are almost always given for internal abscesses, often intravenously, and hospitalization may be required. Early detection and treatment of abscesses are crucial. Abscesses, which are painful collections of pus, can develop anywhere in the body. They often result from infections, and if not addressed promptly, they can lead to more serious health issues. Prompt medical attention can prevent a small problem from becoming a big one, leading to faster healing and less discomfort. By seeking help early, you can avoid complications such as the spread of infection to other parts of the body, which can be more challenging to treat. Trust your instincts and see a doctor if an abscess is large, very painful, or getting worse. It's important to listen to your body and act quickly. Ignoring symptoms can lead to increased pain and a longer recovery period. People with underlying health conditions should always see a doctor for an abscess. Conditions like diabetes or immune system disorders can complicate healing, making professional medical advice essential. Do not try to squeeze or pop an abscess yourself, as this can spread the infection. Self-treatment can introduce new bacteria into the area, worsening the infection and potentially leading to more severe health issues. Good hygiene helps prevent abscesses. Wash your hands, keep cuts clean, and avoid sharing personal items. Simple practices like these can significantly reduce the risk of developing infections that lead to abscesses. Managing conditions like diabetes and maintaining a healthy lifestyle also support your immune system. A strong immune system is your best defense against infections, including those that cause abscesses. Understanding abscesses empowers you to take proactive steps, recognize signs early, and seek medical help when needed. Educating yourself about the causes and symptoms of abscesses can help you make informed decisions about your health. Most abscesses can be treated effectively, especially when caught early, ensuring a smoother and quicker recovery. With timely intervention, you can minimize discomfort and return to your daily activities sooner, maintaining your overall well-being.